Here's Sweetly. I'm here. Vice Chair Grader, here. Commissioner Minor. Commissioner Grid. Here. Commissioner Levitt.
Here.
Commissioner Owens.
Here.
Commissioner Lee. He's here.
Okay, Katie, do you want to lead us in the pledge, please?
Ready?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Do we have any public comments? Okay. We have two sets of minutes to review. We have the minutes from June 12th. We couldn't approve them in, well,
We didn't
have a
we didn't
quorum.
include it in last
Yeah.
month's packet, so we need.
So, has everybody read the June 12th minutes?
So those were the ones that were emailed last night.
Yeah,
on June
she just
12th.
emailed us. Do I have any corrections or additions to the minutes? Okay, can I have a motion to approve the minutes?
So moved.
Second?
Second.
All in favor of approving the minutes of June 12th, raise your hand. The minutes are approved. Okay, now we have to approve the minutes of the September 11th meeting. So they were in your packet. And
Moved.
okay, Mark moved to approve them. Alice seconded them. Commissioner Madrid. Any discussion? Okay, all in favor of approving, let's raise your right hand. All right, it's passed unanimously. Thank you. Now, moving right along, we have a presentation that Catherine and Audrey are from HiCap. And I know just enough about HiCap that it has to do with insurance and you serve the senior population. I have a friend who contacted me who was a lawyer, and he was so confused because Medicare and supplemental insurance was just, it was overwhelming. And so I said, well, get a hold of HiCap. And so I thought it would be a great benefit to all of us to understand what you do, how you help seniors. So take it away.
Okay. Good morning.
Good morning.
I'm the Health Insurance Counseling and Advocacy Program Manager for the County of Ventura Area Agency on Aging. We also have another program that I developed and received grants for, and it's been running for 6 years, and it's Benefit Enrollment Center. So we can do any public benefits anywhere in the county that we have sites at for everything. For SSI, SSDI, Medi-Cal, and there's over about 9 Medi-Cal programs. There's CalFresh, there's Extra Help for prescription drug coverage. There's just the 250% Working Disabled program. So many programs our individuals can benefit from, but one of the biggest problems they have is what? Transportation. Takes like 1 day to get to one office and they're there all day. Then they gotta go to another office and another office. So we brought it all in-house and we can do 8 or 9 applications in less than an hour.
Wow.
So that's what we brought. And as of about 4.5 years now, about a year ago, we had saved over almost $15 million for our seniors and our people with disabilities in our county. So I think it goes to show that it is a valuable service. And here in Oxnard, there is no exception to that. We really have a lot of people that need it. Now talking about HiCap, we are a SHIP, State Health Insurance Assistance Program funded through Center of Medicare and Medicaid Services, also really under the Older Americans Act. So we report to CMS and to the Federal Administration on Community Living, and then to the state, California Department of Aging, and then we are a county program on top of that. So we have a lot of reports to federal, state, county, anything in between. So, but we love what we do, and it's a volunteer program. So it's volunteers that actually do all the work and the counseling. My biggest role is to train them, make them really knowledgeable in all the parts of Medicare and other things so that they can do the work. So they go through 30 hours of training, and then they go through over 20 to 30, 40 hours of shadowing, actual counseling, before they become a registered volunteer HICAP in the state. California Department of Aging is the one that registers them. We are the only state in the nation that have registered counselors. And that is, if we are sanctioned by the state government where we cannot be sued. We got a law passed in about 97, 98 with that. So we have protections for our volunteers, and we're quite proud of that because none of the other states have that. Some states don't even have ships. They just can't get counselors because since the Medicare Improvements Act, Modern Improvement Acts of 2005, 3 actually, it's gotten rough with Medicare Part D, and so many laws have changed. And the laws continue to change every year, every 6 months. So you have to be up on all laws and know what you're really presenting, which brings us to the annual election period that is now starting October 15th through December 7th. So during that time, your Medicare beneficiaries and people with disabilities that have Medicare can make changes. So they could change to a Part C, which is Medicare Advantage or the Medicare HMOs, or they could change their prescription drug plans from one standalone to another. So if they're on standalone, they're usually Medicare with a Medigap, secondary coverage, or retiree insurance, but most retiree insurances have prescription drug coverage in it, and most of it is creditable, and if they were to take a Part D, they'd lose their insurance for life. With the city of Oxnard or the state people, some of the teachers associations, all of those. So they really have to read their letters that they get in October that the employers send out, and it tells them exactly what to do. But a lot of people don't. And we have been able to catch some of those and get them turned around. But can you imagine losing your health insurance for life? It's really important that our seniors read their letters. And those letters we, in simple terms, call them the colored letters because they could be tan, lavender, gray, blue, and they're all letters either coming from Social Security, Medicare, the plans themselves, employer groups, and they're telling them what's going on with one of their things of whatever color the letter is. And most people don't even open them. So one of the biggest things that they can get is a letter from the ANOC, their annual, ANOC stands for Annual Notice of Coverage, or colored letters, is if you have a standalone Part D plan that's leaving the Medicare for 2019, and they don't do anything, they will have no Part D come January, and they will not have it for a whole year. So we really stress this time of year when we're doing presentations, look at your letters, see what they are, come into HICAP because we do Part D comparisons and get them on the going. We do free and biased, so we would do 3 and they could choose the best one out of the 3, and we can enroll them so that they have a confirmation page. And if it goes into that black cyberspace, which it can do during open enrollment, they have a confirmation page that we can work with CMS to get them back on. If they just do it by the phone and get a confirmation number, CMS isn't as likely to believe that they actually did that, but with a confirmation page, they do. So that's
scary.
It is scary, it is scary. So that's why we like to really help our seniors and our people with disability that's on Medicare at this time of the year. We can do up to, I think our highest was about 7,000 in a 7-week period. And that's really not counting the calls. This is actual hands-on work. So what we do is we can go, if they're on a Medicare Advantage plan, we will do the Part D comparisons for those plans, see if that plan is going to be the best one that they're on. Because if they can't get their medication, it doesn't really matter about that's the best HMO for them. They need to move over to another HMO because medication is really the driving force of what you should be on. However, with 2019, the federal government has said they can have home health benefits now in the Medicare Advantage plans. But we haven't seen what that is yet. And I don't know why. Nobody's talking about it. They're talking about that they're giving transportation and they're giving silver sneakers or equivalent to silver sneakers or dental maybe, some of that. But those really aren't your home health benefits. Home health benefits would be custodial type of things like chores, have it come in for maybe someone to help cooking or bathing. But none of them are listing that yet. So we don't know if they're saying the home health benefits is transportation because a lot of them are having transportation this year and a lot of transportation. And there, a lot of them are saying they're silver sneakers or this or that, but it still really isn't the home health. So we're still waiting for that information. Like SCAN is allowing 34 one-way, 75 miles one-way trips this year. That is a lot. So some of the others aren't doing as well. So if you were one to use a lot of transportation, might be good. And that is to either doctors, hospitals, things like that. It isn't to go to the grocery store necessarily or that type of thing. It would be for medical needs. So we have the same players in our Medicare HMOs this year. We have ARC Complete, which is also known as Secure Horizon. They went down a little bit in their premium, but it's still about the same. It's going to cost you about $6,000 of their MOOP. MOOP is the maximum out-of-pocket expense that an HMO can charge you. So you got to think of your HMOs as pay as you go. So some of them have no premium, but when you use services, then it goes into MOOP. So once that MOOP reaches whatever their MOOP is, then you don't pay anything for the rest of the year. But the MOOPs are very high, except for Kaiser Senior Advantage. It is $4,900. That is the lowest. And then I think Central Health, which is the Clinica HMO, I think it's $5,500 if I'm not mistaken. And then Blue Shield is only in our West County. It isn't in East County. So it is about $5,500 with a small premium of $29. So you really still got to do your diligence and do the Part D comparison for the HMOs if that's what you're in to make sure you get into the right one. And then hopefully it has all the coverages that you need. As soon as we have all the different coverages in the home health, we will be printing a list of each one. Then the Part D standalones, we gained 2 different plans this year. Mutual of Omaha brought in 2 plans, and then MLLL. We've never heard of those before at all. They brought in 2. We will be very careful if we suggest Journey, even if it comes up to be a good plan because we don't see any history with it. We like to know the ones that have had good history. We know that if there's a problem, we can go to that company and we can maybe problem solve with the company. So not saying they're not good, just don't have the history on it. We lost first health value and some phonics. So if anybody has either one of those, they have to get on another plan before December 7th, or they will not have insurance, prescription drug coverage by the 1st of January. So that's what we're looking at when we do the Part D comparison and everything. Thank you. I have some allergies today, and I'm sorry about that, but it isn't contagious.
We don't have those troubles. You're not.
That has got me right there. So those are the main thing. Your maximum deductible for a standalone Part D is $415. However, there are some with no deductibles, and the lowest is still SilverScript Choice, and it went up to $34.80 from $28.50, but it's still the lowest. And it's a good plan for those that don't want the deductible. And the reason they don't want a deductible is because, say, if I was a pulmonary client and I had to get on a high antibiotic that would cost maybe $500-600, I'd have to pay that $415. However, if I have no deductible, I just pay the copay, the 25%. So a lot of our seniors like that and are willing to pay a little bit more to have that, because that could be really hard to come up with a full-fledged money. A lot of them have the $450, but in it, it is generics could be $0 or $1, so that's not bad. They may not even get out of the donut hole into the donut hole with that at all. And the donut hole starts at $3,870, I believe it is this year. And then you pay 25% for brand and 33% for generic, up to $5,100, and then you pay catastrophic at $850 and about $380, I think it is. So in year 2020, Part D goes to no what? Donut holes. So you know how you have just your copays all along? That's what's going to happen in year 2020. So this is the last year, 2019, of that. So it is smaller, but there is some sacrifices. From what we can see, a client could be in the donut hole for a longer period of time, unless they're using some really expensive medicine that really get them through.
I don't understand that.
Pardon?
I don't understand that. There will be no donut hole.
In 2020. January 1st for 2020, no more donut hole, no more well, there could be deductibles, but you would be paying your copay of 25%.
So there won't be a ceiling.
Correct.
Oh, okay.
Well, that could be remained. I won't say there won't be a ceiling, but there shouldn't be. We'll see. They might.
That's good, isn't it?
Yeah, it is good.
Who have these experiences.
Yeah, so if you just have to pay the 25%, yeah, there won't be a donut hole, so there wouldn't be that kind of a ceiling. You're right. So that's good. Really good. So what happens in the donut hole? Let's say that I'm taking a injection for diabetes and I get into the donut hole. Now it goes way high in price that I can't afford. What can I do? Can I do anything? Yes, you can. You can come to us and we will look at the patient assistant programs and see if we can get it for free for you. But you have to be in the donut hole. And they give you a letter that says you're now in there every year. So if you don't have that, you won't have that worry. Or if you get on a really expensive medication during the year and you have to have it, we have wrote social economic letters and we've been able to get clients on the patient assistant programs, even though they're not in the donut hole. So, send people our way because we know the ins and outs of what we can do for them and get them on things to help them. One other thing is if you are taking some really low generics, like maybe they only really cost $4 or $5, maybe $10, maybe you want to buy them outright and not use your Part D, because when you're using the Part D, that's adding to the donut hole. And if you can get them just as cheap outside, do it. Like I know Walmart has $4 plan for 30 days for generics, $4, $10 for 3 months. And even Costco, they have really good generic medications that are very inexpensive. So if you are one kind of a heavy user that could go in to a donut hole, I would be looking at some of that to try to defray the cost of getting into the donut hole. Now, we do have some that will be in a donut hole within February. So that's not what I'm talking about here, but it does help.
Would those be also very good if you've got, an infection or something, it would only be short-term taking those things than to go and see if you can get them there cheaper, so you.
Well, actually, Walmart has a list on their website, and I think they call it the $4 generics or something like that, and it's just really robust. So I would look at that, and you can always call, at least you used to be able to call Costco and see what a medication would cost. And you don't have to be a member of Costco to use their pharmacy. So that's another advantage for our seniors. I will leave all of you a pink. This is the limits of all of our benefits, public benefits. So this will tell you, and even if it's around that, they should come in because we know how to spin down or do things. So this is a really nice little handout. Also, how many have gotten their new Medicare card? Good. If you haven't, and you should have, you need to call Social Security because every one of you should have your new card if you're Medicare age. And so it probably meant that you have some updating to do in Social Security, like your address or whatever, but get to Social Security because yours was finished on June 30th here in California. This is our Part D worksheet that we give out to have people fill out. And then we also have our one-stops here for all the year of this open enrollment or AEP. So as soon as anybody fills this out and gets it back to us, we call them with a date for like either at the Oxnard Wilson Senior Center, South Oxnard, on C Street,
Palm
Vista, and at Port Hueneme. And they can go wherever they want, and we will be there to go over everything with them after we have that. Let's see, what else do we have today? So, well, if you want these, we're more than happy to leave it. This is about the ANOC colors, letters, and it just tells you what there is so that you know. I mean, it really helps because people just throw them away. And we say, we're out saying, put them in a box, put them in a bag, bring them to HICAP, let us read them to see what's there because it's really great information. So that is for the ANOC letters or the colored letters. We don't use brochures anymore. And the reason is they got too costly for us. We're on a very tight budget and the federal government keeps putting us down. So we do this. It's the same thing as a brochure, and it has everything in it, but it is a postcard. And so we have it in English and Spanish for all of our Medicare beneficiaries. So now Medicare beneficiaries is 65 and plus, correct? But it's also under 65. You could be even a child and be on Medicare. And that's through our Adult Disability Resource Center that we worked for about 5 years to be designated in California with California Department of Aging and Administrating of Community Living. With that, now they just upgraded us to do children also. We were doing 18 and over, but now we are doing children. And so our motto is there is no wrong door. So if they come to us, we're gonna serve them. And yes,
So when somebody turns 65, they still need to apply for Medicare even if they are currently working and still have insurance?
that's a good question. So the rule is if they're working, if they're gonna stay working, they can go ahead and apply for Medicare A. It's free because they usually have always worked 10 years or 44 years. And they would defer Part B because Part B is outpatient services. And normally your employer group is gonna pay more. And a Part B minimum premium is $134. And unless you're gonna spend $1,600 or more a year in Part B services, it doesn't really pay you to have Part B. Now, if you're a small company with 20 or less, you have to have A and B. And then they would be primary and your employer group would be secondary. But for anything over, your employer group will be primary and Medicare would be secondary. But if you plan on retiring for your 65th birthday, then you need to apply for your Medicare 3 months prior to your Medicare birthday. So if my birthday is in December, and let's say it's the 15th, my Medicare benefits would always start the very first day of the month. But if my birthday's on the very first day of the month, it will jump backwards a month to November 1st. So you want to make sure you get that going and then get into HICAP so we can explain all the different Medigaps and all the different HMOs. So you can see how you want to go, give you the pricing and everything. And then you would be on it and ready for the very first day of your birthday month. So we
So
do
if
that.
they are working for a larger company, they do need to apply. Their
You know, they
company will
don't have to,
insure-
but it kind of makes sense to do a Part A because if something really happened, maybe Medicare Part A would help some, maybe it wouldn't, but it's free, so why not? Where Part B, on the other hand, does cost, so you really have to figure out, are you a frequent flyer with services? Or if you're not, it's probably best not to take Part B to defer it. And then when you do retire, your human resources would give you a form to take to Social Security to be reinstated in B with a guaranteed right, so you wouldn't have a penalty. Yes, ma'am.
When is the last day of the enrollment to change?
The Part B enrollment?
Yeah.
Well, you're supposed,
I think of open enrollment,
Open enrollment.
December 7th is
December.
the last.
well, if Medicare open enrollment's October 15th through December 7th. But Part B, it depends on if you're new to Medicare, it would be the 3 months prior to your birthday, your Medicare birthday month, and 3 months after. Now, if you're working, when you stop working, you've got to have human resources give you a letter to get that reinstated into Part B so you don't get penalized. So there's different rules, so call us, we can go over every rule with you so you don't make a mistake.
Do you already have a schedule to go to bar? Because you went,
Yeah,
you went there and,
there, I think there's some extra things there too.
Oh, on the bottom.
Yeah.
I think that-
She's gonna get you some. We have a whole list of our one-stop shops.
yeah,
For
you
all
went
the
to bar
county.
already.
Yeah,
That's
at the
last
time
week.
and date. Yes, ma'am.
Thank you for coming to our centers, but is there an office if we miss your center appointments, perhaps?
What now?
Can we visit an office?
Yeah, you can go anywhere. If you were over in Thousand Oaks and we're gonna be in Thousand Oaks, you're welcome to come
But
in.
can we come to?
No, most of Oxnard honestly come to our office in Ventura. And we kind of encourage it. It's not because we don't want to serve here, but we have the computers running and going, so we can do it, everything
So
right there.
Commissioner, you wouldn't have to wait. You don't have to wait until they come back to the center. You
Right.
could go over to their office.
Right.
But where is it?
We're at 646 County Square Drive, Suite 100 in Ventura. We're the Ventura
Yeah,
County
that's-
Area Agency on Aging. Across the street from the Government Center is where we are, behind the old Acapulco restaurant, if anybody knew that restaurant. That's the easiest landmark to say.
But you can get a bus over there.
The bus.
They're actually there tomorrow at SLC. I got
Yes.
this there tomorrow.
For,
Oh,
Yes,
for
it's
a
not.
presentation.
We're there for a presentation. So if you want to have this today and you fill it out and you bring it tomorrow, we'll take it back to the
There you
office. We will do the Part D comparisons and what have you, and then call you to come back at either here in Oxnard or in Ventura, wherever you might want to go.
You live in a world of acronyms, so you're
I
throwing
know.
them out like, and I think, oh my gosh, what are those?
And there's more I'm learning.
I know, gosh. And they just come right off your tongue. On the Part D, if my supplement is Blue Cross for my health insurance, do I have to have Blue Cross for my Part D, or can I go
So you,
shopping?
so you're telling me you have Anthem Blue Cross Medigap, correct?
Right,
Okay, no, and you shouldn't, because 9 times out of 10, the plan that's gonna work for you in standalone Part D is not gonna be the company that you're with for a Medigap.
I mean, it all changed this year, because it used to be one premium, and now they've
They've separated it out.
separated it, and I, as you were talking, I thought, maybe one of these other plans might be better for me.
They like to sell it together, sort of, because they just make commission.
Well, it was a no-brainer, I didn't have to work
Yeah,
at it.
it is, right, yeah. But I'm just gonna play devil's advocate with you. Did any of your prescriptions have prior authorization
Oh,
on it?
yeah, because I'm asthmatic and I'm just having a terrible.
Oh,
time
you had
getting
some probably,
three of
so you could, if they have a prior auth, usually that means you will not get that medicine, and you won't know until January once you're on it. So we would go look for something else that wouldn't have a prior auth, so that you're not gonna have the problem of getting the medicine.
And they keep changing the formulary too.
They can change the formulary month to month.
Oh, I'm gonna come and see you.
And then let's look at quantity limits. So quantity limits means you always get the one for 30 days. But if you take 2 or 3 a day, that second and third dosage, you could be paying 100% for. So we look at quantity limits, make sure there's not a problem with that. Step therapy is pretty easy. That means your doctor's tried medication A, B, C to get to D. That's not, but if it's got a big NF, that means non-formulary and you're paying full price. You don't want that either. And most people that are doing their own Part D comparisons, they really don't look at the ins and outs of this.
I've done it on the phone with
Okay,
Blue Cross, but
but they're not
I
giving
know.
you the full thing of all the others out there,
And-
because we put it in the Medicare Part D plan finder, and those medications go on all 30, and it will give you the first 5.
so I'll just bring my little bag of
Yeah,
meds.
that's
Because I
fine.
have, you know, a
We're used to the
$500.
bags or the whatever, you know, it's not
Well,
hard at all.
One of my inhalers is $500 and they're trying to avoid paying for it,
Oh,
but it's the only one that works. And,
asthma inhalers are really bad. They like to just really be
I had some that-
non-formulary.
yeah,
Prior
worked
auth.
and then they, all of a sudden they quit.
Yeah, yeah.
And also I understand it's Express Scripts now, but Anthem's gonna start their own pharmacy.
They could.
Yeah.
We haven't quite heard yet what it is, so, but they could do it in the middle of the year or whatever.
I'm gonna come and see.
Okay. I think I think if you have any doubt, do a Part D comparison and just see really where it is. Because if yours is the best, it's gonna show it and you don't have to do anything.
But if I wanna change, now during open enrollment's the only time I can change.
Yes. And then the one last thing I will tell you, for those people that have extra help, meaning they get their Part Ds at a lower rate, they can change month to month, either their HMO or their standalone, but in plan year 2019, it's gonna go to quarterly. They can only make a change once a quarter for the first 3 quarters. The fourth quarter during annual election period, October 15th through December 31st, they cannot. They just have to do the election period, but not by itself. This is gonna be huge for those type of people, because they're so used to getting mad and I'm going over here, I'm going over there, and it isn't going anywhere.
Catherine, this is wonderful, wow.
So a lot is changing for 2019, and there will be a lot more changes coming up for 2020. So you all need to be staying alert. And the best thing is, I don't know if you got your Medicare and U book yet. We did, but we have them in our office. It is the best book ever. I really enjoyed it this year.
I put it in a drawer.
I mean, seriously, most years, it hasn't been that good, and I'm an editor on it, but this year, they really outdid themselves of explaining everything.
Right.
So read that too if you need any kind of, confirmation. Except in Part A, it says if you get Part A prior to your 65th birthday, like the couple months ahead, it'll go 6 months backwards. No, that's not true. They really made a boo-boo there. But other than that, it's really good information.
Wonderful.
Is Part D the one that's based on your income?
It can be, yes. And so if you make up to, on here, for $1,538 for a single person or $2,078 for a couple, you could be on a Part B at a lower level. Or maybe you won't have to pay a premium, no deductible, and your generic could be like $1.20 and brand $3.80. Or it could be a little bit higher if it's higher. It depends on where your income is in that range. So we do extra help applications, just try to get our people on extra help because it is a huge savings, especially for asthma and diabetes and things like that.
Did Jeff have a question?
No.
Oh, you're just resting. Yeah, I'm
I've already got his mind going. He's going, oh no, what am I doing?
I was with a group this weekend.
I thought I
and
knew when I was
talking about
doing
statins and how expensive they are, and it's thrown so many of them in the donut hole. The statins are just so
Yeah.
expensive.
But it's going away in 2020. That's the best thing
Oh,
that ever
I'm
happened to
gonna
us.
be the smartest one in the group now, I can tell them. Too bad I didn't know this yesterday.
So do you have any other questions? You can always reach out to us. The best way to get to me is by my email, and I'll give it to you. It's Catherine, KATHARINE .Raley, RALEY, @ventura.org. I usually get back before 24 hours with my email. If you call me, I only pick up my phone from 7 to 8 in the mornings because I'm out in the field and doing all this, and I just don't have time to get to the phone. But if you email me, I get back to you.
Fabulous, thank you.
You're
so
welcome, and
much.
thank you for letting us be here.
Oh, appreciate that.
So we can leave.
Okay, yeah, so you're leaving the
Yes.
colored sheets, that's interesting. And you know what all the colors mean.
Pardon?
You know what all the colors mean, right?
Yeah, I do. I just know that you need to know if you get a colored letter, it means you gotta do something and let's get it figured out. And that's what we try to say is don't throw it away, do something with it.
Do you want me to just leave these on the back table and then you?
Yeah.
That'd be great.
That'd be great.
So now, are you the Senior Service Commission on Aging?
Yes, yes,
And so you sit on our board, don't?
I
someone?
do,
Yeah.
and
You do?
Clark does, yeah.
Ah, okay.
And, because people come, they know that we're on the commission and they come and ask questions. And I didn't know, but I knew May Lee, and so I called her. And the senior that had the problem, he had Part A, and he'd never signed up for Part D, or Part B. And so he wanted to know, how do I do that? And as intelligent as he was, he just thought it was overwhelming, you know, to go through the paperwork.
Well, there's no dumb question in when it comes to Medicare and employer group and what have you. Because it's really a maze, and if you don't do the right thing, I honestly, I'll tell you this one true story because it happened about 9 months ago, but I just got an email from him this morning, and I could just, he was a huge insurance broker back east, and he has some dementia, Alzheimer's from some strokes and a few things. And so he doesn't sell or anything. They sold the business and everything, but he's sharp as a tack. But he has memory loss. But he still remembers things, sort of. And when they moved out here to California last September, he asked to get put on a Medigap for he and his wife, and they put him on an HMO, both of them. And it took me until, I think it was May of this year, that we won our case. And they had to put him on and everything. And the insurance agent, he got sanctioned because he did wrong, and they found that it was wrong. This morning I get another email from her. He didn't pay our premiums and we don't have it. What do I do? And I said, I can't do anything for you. They know he's conserved. Why would you let a conserved individual pay the bill?
Yeah.
You know, and I said, well, do this and do that. And so she's calling them, and, you know, hopefully if it isn't over 30 days, maybe they'll let him do something. I don't know. But after all the time it took and to get them, because he really has services, and then you were letting him pay the bill.
Yeah.
Okay.
That's like letting him take his own medication.
Yeah, you know, so, you know, I thought I had them really good. And they're kind of like the penny, you know, that penny that keeps coming back. But that's what makes our job.
Well, thank you so much.
Yes, thank you.
You're welcome.
Okay. Yeah, Jeff, I'm sorry, I skipped over you
I
because
know,
I did.
I've already notified the state.
The VIP section was ignored.
Was
That the agenda
this-
wasn't following.
Yeah, this was a violation of the Brown Act.
It's very from Brown. If you put out, was it Brown?
Yeah,
That's his name.
I'm sorry, but I just thought.
No, that's why they were here.
Okay, well, now,
Okay, so,
Commissioner Nevin will give a report
Oasis.
on Catholic
Catholic
charities.
Charities Oasis. I had the pleasure of being the first commissioner to go to a grantee right after, no, letter went out saying. So I wore my Kevlar vest. I met with Lisa Nagy, and I think most of you have probably met her. We were at functions, and I think last year she isn't here today, not because of the grant letter, but she just felt that it would be fine if I did this. If we have any questions, and she sent some brochures for all of us. Anyway, this was the update on, sure. This is the update on their progress to date through the year. And she said she hadn't connected with you. She had gotten your voicemail.
She was on
She was on vacation. But she got the letter and she understood it, and she wanted to assure us that they would continue to work with us. And I guess you had mentioned some other potential sources.
We've touched base since she returned.
Yeah, so, and I did notice that on the calendar this week, they're in each of the senior centers. Each one day this week, so they're continuing to, let's say, earn their money, but they're very dedicated. Catholic Charities, the main office here was in Camarillo. And the only thing that I learned, and I remember last year we did the grants, Al had said, well, they're part of Catholic Charities, why do they need money? And she told me how much they pay Catholic Charities for services. Basically, they've given them an office in the building behind the church, but they pay for bookkeeping and for payroll and all that stuff. So they get some money from the parishioners and stuff, but they're not overflowing with cash. And it says that our letter actually came as she was trying to cobble their budget for next year together. So their annual budget is about 300, well, not about, Lisa's a very exact person, $362,412.
62 cents.
No, she did round to the dollar, so. So the budget's 362, we had given them $5,000. Said, you know, towards the general fund that they have. They didn't really specifically set it aside for Oxnard. They have 7 full-time employees, of which she is one. They have 4 regional coordinators. I think they have an office in, I think it's Thousand Oaks and in, I'm not sure, it says it in here. Santa Paula and maybe in Simi. But they serve in the county, Camarillo, Fillmore, Moore Park, Oxnard, Peru, Santa Paula. It's not every city in the county, but it's the main cities. The volunteers, currently about 55 volunteers. And their mission, which should have really started with that, is really to keep seniors independent in the room. And it's interesting as I'm putting together the last chapter of subcommittee report is on in-home care, and there are not that many free services for in-home care. There's a lot of paid services. You Google it, it fills up your computer screen. But when you do free services, I really only come across 3, of which they were one in this county. They serve currently about 367 clients and 600 outreach. So they do get to other people, but they're currently in about 367 homes. If you call them, they claim they will respond, and she swears by this, that within 24 hours you'll hear back from somebody. They'll come in, they'll do an intake at home, and they'll assess your case. And I said they have 367 clients in Oxnard. They serve 132 people. So they're kind of important here. You know, how do you reach out to clients? Well, one of them is they do these senior center things. They're at health fairs. And they do community outreach and a lot of church work. They do a lot of canvassing churches. So if somebody does belong to a church and they go to the services in the church, they'll often get referred to. If it's the Catholic Church, this is probably in the county living. How are the funds used? The funds are mainly pay the salaries of the bilingual, they are bilingual, of the administrative assistant and the regional coordinator. And they do raise their other, because I asked them, so you lost 5 out of $362,000, only about 2% of their budget that we had. So I wasn't that depressed when I left.
They didn't keep you up.
No, you know, as I said, Renee clued her into some other avenues to get some funding. And I said, maybe next year, we would stay on grants. And they raise their funds through grants, donations, and bequeaths. You know, people pass away and they leave money in their wills. So that's basically where they're at right now. Interesting service. Last year I got deeply involved with Tony Miller. He became my buddy. He gets Bob dialed from me by accident. He has the same name as my wife. So I say to the car, call Tony. All of a sudden, Tony Miller's number is on the dashboard of the car. And it's like, no, cancel call. See, he's probably wondering why I'm coming, but she was great. Again, it's the best thing in the 2 years I've been a commissioner, really, other than people, is just seeing how dedicated these volunteers are. I mean, she's salaried, but so dedicated to their cause. And they do help a lot of people.
One of the things that they do as well, they have wheelchairs and
Right? They
walkers,
they
and
like
that kind of
things,
thing. And I know when my husband was bringing him to the hospital, I thought, I need this stuff and I need it now. And I called and I said, do you have one of those chairs in the shower? And they said, we just had one come in. This went by, and I mean, they're just so giving.
They're
They just,
fantastic.
you know, they didn't want any qualifications. I mean, I could have gone out and bought one, but it was just, I needed it
Yeah.
right then. And
No, it's helpful. When I had my hip surgery, our community has an equipment sharing program, you know, where people just, when they're done with it, they give their stuff in. And it's nice if you need a walker for 3 weeks, not to have to buy.
Yeah.
one. But they do in-home assessment, case monitoring. Sometimes they're not medical, so if they see there's a medical need, they will refer it to another person who will come in, usually through the family, tell them, you need to move this. And she said some of their stuff is just companionship, just people who are lonely. And you'll appreciate this. They have a birthday program. You don't have to be 100, you can still get a birthday.
hey, well, thank you.
Yeah, if
Jess.
there's any questions, you know, she said just give her a call.
You had an unenviable
She made it easy.
experience, but yeah, she's a really nice gal. Okay, so moving right along, report of the commission secretary.
So I do have a few items, just going off the same note of CDBG funds or grant funds. I did contact all of the agencies, and before the letter went out, I put a phone call out to basically prime that it was coming and on its way. You know, it wasn't a conversation that I wanted to have with you all, and let alone the actual agencies to notify them that the funds were lost, but I didn't expect the amount of support that was given. You know, I think all of them were more than understanding of the situation. They know the climate of Oxnard and understand and have heard of cuts going on. And they've dealt with it at other levels too, but the one message consistently was, don't worry, programs will not be cut off. We will still have a presence, we will still work together. That amount of support and just camaraderie that's been built up between the agencies, there's so much history beyond just financial funds. And, you know, I mentioned CDBG and any support that they needed with the CDB application. So some were willing and some said that's too much work. So, you know, they'll keep their eye out for the application being posted and apply. But it was well received, I can say that. Really the only agency that said, you know, I'm gonna have to go for CDBG funds was Graylaw. They do get a grant from BC AAA, and this was part of the match. So that was really the only agency where I received, you know, a heavy heart response with it, but everyone else seemed to be able to bounce back.
I thought about passing the hat for that Shop Ahoy. I just think
You
that's
know,
such a marvelous.
I can't tell you, Tony Miller, I knew Graylaw was gonna be impacted, and so I thought of Graylaw and Shop Ahoy as far as having the greatest impact. Tony Miller was so compassionate and more worried about us than he was about the program losing money. He's the greatest guy.
Call him Jeff.
So-
Feel better.
Next time I try to use that voice thing on the car. It'll probably be him.
I was trying to reverse him consoling me and he just wouldn't allow it.
I just sent him a new phone.
Oh, good. Living Well magazine that has all of the services available to seniors. The new magazine is supposed to be released on the 29th of this month. So as soon as I receive word that date is the release date officially, then we'll be picking up some boxes and share them with you all. So if you know of any area where you can distribute them, just give me a heads up. Jeff has already contacted me and said, get me a box. I'd like to put it in.
By the 22nd.
That's wishful thinking. That, you know, if you can distribute them in your homes and, you know, if you live in an HOA and there's a place that magazines like those can be left, just let me know ahead of time and I'll make sure to grab you some magazines. The 29th of October.
Are you distributing automatically to churches, or that's what you're asking us to do?
So if you have churches, you can definitely, I can give you a box to distribute them. They go out to all of our senior centers. We leave stacks at the senior centers, our office. From there, it's just going to be distributing. There, you know, we've asked for a plan for VC AAA as far as locations that they do get distributed, and there's not a solidified list on that.
The exercise program, I can't think of the name of it. Zone builders, that's what I was trying to think of. Can you give some to them and ask them to bring?
I usually give them to the instructors, not a whole, not like 15 of them for everybody in the class, but the instructors get them so they have access to information.
And then tell them.
Next item is Las Cortes, the Colonia Housing Project. I had mentioned that I was working on that. We had some funding conversations that needed to be had. So I have somebody in housing that's being responsive and being a teammate and trying to resolve this, get me some answers. The problem is housing used to manage that location, and so they had grant funds or HUD funds that were specifically set aside for social services such as a senior center. Now that it's going to be under a developer, they can't use those same exact funds. So she's digging to see if there's some sort of other funding that's available and can potentially be supportive. If she comes back and says no, then my next step is to go to the developer and ask if they have funds that can support us being over there. We've been pulling numbers as far as Palm Vista goes for quite a few months. I would say the past year easily, we've been pulling numbers to see really what would be the impact if we pulled the senior center out of Palm Vista. There are about a third to half, depending on the month, of seniors that are coming from that housing unit and using the services of the senior center at Palm Vista. So it, you know, when I first came on to senior services, Palm Vista was trying to grasp itself at that location and trying to really get a program going. So I'm being sensitive in okay, how is there a possibility for us to stay there and potentially move to Colonia, or what would be the best bet for a senior center? Myself, Deanna, and George, who's our Palm Vista director, went and visited the Colonia site yesterday. So that was nice to get an eye. It was like walking through a model home. They had an interior decorator. It's beautiful, beautiful. It's small though. The main room, maximum occupancy is 54. And they have a fireplace set in the center with couches around that fireplace. So serving senior nutrition wouldn't necessarily be an option if we couldn't serve the amount that we're currently serving right now. We have the youth center across the street, we have the Colonia basketball gym, so we might be able to take advantage of our other locations around there to serve senior nutrition. And, there's some different ideas of what we can do. It's gonna take some time, I'm doing work on it, I said yesterday that I wish some of this was discussed and solidified and questions were answered before promises were made originally. I'm kind of working backwards at this point, so I'll just keep you posted. I'm sure I'll have progress next month. It's a slow crawl sometimes with things like this, but we're bugging, we're contacting. I have individuals on both ends that are my contacts at this point, and we're working towards it.
So you're saying there's technically 3 buildings, but having programs, some programs in one building and some programs in the other building, are they close enough? So
They're a stone's throw from each other.
So the senior could walk,
yeah.
even the handicap person could
Okay.
walk.
Oh, yeah,
So that's.
Right. it's a stone's throw from each other.
And the youth and basketball aren't probably there
It's
at
the same
noon
thing,
time.
our South Oxnard Center is a youth center and a senior center. Youth are in school when we're
Yeah,
programming, so
you're-
it's
It's better youth.
the only time that it would impact is during the summer. We would have to figure that out. But there's 148 units that were built. 45 of those units are dedicated, and this is not 100% guaranteed information, but this is what the project manager was telling us yesterday. She believes that there are 45 units that are being set aside for seniors out of that.
How many were there before?
I don't know. I don't know.
You never know, when no one ever had
I
a thing, so
don't
we don't know how many seniors.
The individual that was responsible for this building project retired. So that history and, the individuals that were around when this project was started are no longer around.
And
So-
then this guy's gonna retire too.
He's already gone. Arthur Lowe's already gone. Yeah, so that was actually my thing to get in writing before he left, of somebody that is assigned to me.
So our current housing director just retired.
Hmm.
And he was only here long enough to say, I know nothing. I don't know what's going on.
Mm.
And then Renee got a commitment finally.
So we keep moving forward. There's conversation happening. We were able to visit it. We're being told that it's for us, but I'm getting mixed messages on that too. There's a manager's office and not sure if that manager is us or is the developer. So there's just a lot of questions that still need to be
I think
answered.
as a commission, we hold the city council speak to the fire. They can't promise this stuff and then take it.
Right.
It's
Well,
just
and they
not
shouldn't promise if they don't have a procedure in it, figure it's carried through. This is that, looks like this, but no one ever said procedures, and of course we kept fighting for it. Thank goodness, at least.
Yeah, and I came to senior services right about when they broke ground, so I don't have that history. I've learned it along the way too.
And I don't think the city council's opposed to it, but it's
No.
just trying to find the money.
Well, we'll press, like I said. I'll work.
Yeah, that's good.
So, and then the next item, on a happy note, holiday parade, December 1st. So we have the Tamale Festival and the holiday parade, and the senior, is going to be, they're already meeting, I already have my list of supplies to buy. So everything's rolling with that. The theme this year is
Bright lights or.
Merry and Bright. No,
Making spirits.
Making Spirits Bright. Making Spirits Bright. So if you sing the Jingle Bell song, you'll figure out where that came from. But it's Making Spirits Bright. So my question to you all is, do you want a vehicle in that parade? And if so, who is interested in riding in that vehicle?
Well, I've done it for 5 years. I don't know. Anybody want to go with me? You're busy.
Well, I'm not sure whether we're gonna participate or what we're doing, so, in the parade this
Might
year,
not be
so.
on the trolley.
So I may be on. truck,
After
Acura.
usually does, but she. But
Yeah.
I usually gonna ride on the
Yeah.
vehicle, but you're-
She usually
She's
She's
goes
usually on
her
the float,
float.
you are too. Oh,
You know what, they're very.
then we'll dress him up like Santa. Now that Alex Trebek shaved off his beard, I told Clark he was the Alex Trebek lookalike.
Okay, so I have Clark and Alice down. So you're all waiting now, and then, okay, just keep me.
Now, if
posted.
your grandchildren are here, you can ride, take your grandchildren on them.
Well,
Got your parade
one lives in
weekend?
Oakland, he's only 2 months old.
Oh.
Maybe he'll drive.
Could be his first parade.
There you go. See if,
It used to be we could throw candy out in one.
see if my grandma.
Okay, so, that's it. That's all I have.
Okay, so then new business, senior services programs and events. Anna? Oh.
It's ready.
we have a real presentation.
I wasn't able to open.
Bear with me.
the document.
I couldn't either.
Yeah,
Yeah.
it was some sort of Google
Yeah.
format.
Slides or something, I never could. It
It
said,
wasn't
it
PowerPoint, it wasn't PDF.
it said the application is missing.
I'm-
It will be going out,
I downloaded, but you have to request, I requested access from you for some reason.
Well, I get that all.
Yeah, Google Slides.
so, it will be included in your packets.
So I'm gonna know.
She has such power, doesn't she?
Yeah.
I'm holding it to myself. All right, you should be.
Okay. Let me try it. It's weird.
If you're on Oxford Senior Connections, hold on a second.
Is that why? That's what we use for YouTube and everything.
No, but I get things from Renee that says I have to have permission to open. It's just something. It's technology.
Yeah, oh, I know.
You know, it's just, you can't explain it. Sometimes it works and sometimes it doesn't.
Yay! Okay.
All right, so Mary Sue is up first.
I'll be the clicker.
All right. So, I'm really excited about this first item. We've got, CSUN physical therapy graduate students have been looking at bone builders for about 2 years. Maybe we started 2 classes for them to study. They don't have a final report ready to be published yet, but they have written up an abstract based on the findings that they hope to go to a world international Congress on physical therapy in Geneva and report more the results of their study. So, and the preliminary findings that they sent me were found a significant improvement in 10-meter walk test and the timed up and go, and activities specific to balance confidence scale. What that means is people who participated in the 12 weeks that they studied showed improvements in reducing fall risk, including your gait speed was better, so they walked faster. The dynamic balance was better, balance confidence was higher. And they had better life satisfaction. And overall, the risk of falling was reduced. And they, the implications were that the program has potential to significantly enrich the lives of community-dwelling older adults by improving gait dynamic balance skills, increasing balance confidence, decreasing fall risk, and improving life satisfaction. It is a worthy program for physicians and therapists to consider when referring older adults. So very cool. They just wrote up that very short abstract that they sent me. They're looking, students are in the final phases of writing something to be published in a medical journal. So these are the steps you have to take to become evidence-based. So that's what we're working on. So
Helps to get, you continue to get funding.
yes, or potentially funding outside of the corporation, outside of RSV, expanded further. So, and then we had a few articles in the newspaper. Betty Berry wrote about carpet.
Oh, great, oh,
Yes.
Yeah, she always just, yeah, great.
So she had interviewed, I'd set her up with the guy who runs carpet for me. So we were very happy to see it published. We
She
also,
usually only writes about.
yeah, she's happy to write about us if we get to her. Get, you know, her.
She works off of
So it's interesting. Our Tai Chi program was, we started 7 classes. And so I sent something into the Breeze classes that started in Ventura. We filled those. I also wrote to the Santa Paula Times. This is right on the edge of Ventura, and they published it. And then I come to the Tai Chi class.
Jeff.
He did offer it.
It's not free. I'm for hire.
And then I wrote a note to I just wrote like that, I thought to the editor of the Breeze saying thank you for publishing it, that the classes which made volunteers feel like their efforts appreciated and how important they were to everything. Thank you. My first name, my last name. For the program.
I think Renee, a copy of the magazine, which covers like the non.
Okay.
And we run, Matt, we're running the plans.
Right.
It says that we do something.
I also put the 2 classes that started in October in the happening zone. So we've been out a little bit.
It wasn't very hard to, but we were concerned that classes for a lot of the same times. It was a waiting list. Actually, right. 2 people dropped out, I think. Luckily. People were bumping into each other.
Not falling, not falling.
Yeah, don't say that word.
Overcrowded Tai Chi places.
next to the overcrowded school.
So we do have the 7 new classes. There's 3 Ventura, 2 here in Oxnard. We have the one that's in the Wilson Senior Center, and Seabridge, and then 1 in Camarillo at. It's still open actually on Central Avenue. Tomorrow through 2nd class, so people can join that one. It'll be next Monday. And then Leisure Village has a class. I had suggested to them, the instructors seem to feel, boat builders, I tell them to please limit it to 15. I haven't been that strict on this. And I think they feel like they need to take everybody because it's 12 weeks and they have to wait 3 months and then they don't have the services. But we're meeting on Sunday, and one of the things I'm gonna share with them is they don't have to have a class meeting. They can say, we need to wait the next time. And we're getting more instructors all the time, so potentially that we'll have another class. You had asked me in July, even if we had 7 classes right now. So 7 is great. Our trainings, I did a bone builder training, bone builder instructor training on Thursday. We have 40 people. And essentially I'm using them to backfill instructors guy. So I need backup in some of the classes. And we also have a Tai Chi training this Friday, Saturday, and Sunday. And it hasn't been published anywhere, even though I send out press releases all over September. We put it on Nextdoor. So, got 3 or 4 people, and I'm bringing in the people who've been trained and haven't been certified yet. Get better, so they can get certified. Medical community outreach, we took our survey that we do every year with the bone builders. And one of the questions we ask them is how they heard about us, and if they hear about us through a doctor or physical therapist, we ask them to share who that is. We took all of the people, and they reported, and we sent them a thank you for sending people to us. And then also included the latest brochure from Tai Chi. So I think I went after about 30 people. So you can go to the next slide. So these are the survey results, Jeff, from our latest survey that we did of all the bone builder participants. We had 404 people who have been active for 2 months or longer who responded. And, just going through it really quickly, the impact, the first questions at the top are questions I've asked since year 1. And you can see, we're all the results are in the 80s. And improved strength, improved balance, improved flexibility, energy, well-being, and social. So, the impact we're having in that regards is good. I'm happy with that. The next one on strength is how much people are lifting. But the next one I really enjoy, the bone density changes. So we asked people if they have taken 2 or more bone density tests since joining Bone Builders, if their bone density had increased, decreased, or stayed the same. So out of the 404 who responded, 143 of them had a test, had 2 tests or more. And 39% of them had increased their bone density, and 48 had stayed the same. This is the age group when your bone density is typically decreasing. So the fact that only 8% of them reported decreased bone density is pretty good. I pulled out the ages just to share with you. I love this. 90 and higher. We have 28 people who are age 90-year-old. We have 43 people aged 85 to 89. 75 people aged 80 to 84. 73 people 75 to 79. And 79 people aged 70 to 74. So you can see the bulk of our folks are, the 75 to.
Isn't that great that they still want to do it?
Yes, I'm really encouraged by them. The one thing that we actually report to the federal government is underneath the social impact. This is, this section of it is something that they have put out as the type of questions they wanted. So I just added them to our survey. And the only question I report to them is next to the last one that says, because I participate in Bone Builders, I feel I have close ties to others. And that's 79% of them, which is good.
Yeah.
Really good. And I love that 91% of them have paid. So up on the screen are some of the written results that we received. And you can see that a lot of them have to do with being, not just the exercises, but being together. You know, being able to spend time together, but able to climb stairs, not parking in handicap spots, like having an extended family. You all can read them. I wrote down something that I didn't put up there, but I found it while I was looking at the ages. I had a 91-year-old who wrote, "I've changed since joining Bone Builders. I have more self-confidence and I've met more." The fact that people can change
At 91,
91
yeah,
because of a program. is just
and then they're open to it.
Yes, yes. So anyway, I think you guys all have these slides.
Yes, we will.
So, I don't want to go through all that.
Depending on how.
Well, can't get there. So the other thing I wanted to share was at the Alma Vita class, they had a participant who died. She was sick for a while and went to a nursing home. The students visited her in the nursing home, but her family wasn't going to do any kind of service for her. So the Bone Builder instructors decided that they would hold a memorial for their class, and they invited people who used to be in the class and all the current class members, and the family came, even the people from the day nursing center, they came and they just did a little remembrance memorial for this woman. So everybody has it. It was apparently a really well attended event. They just sat in a circle for what they tell me, and they shared some memory of it. It's sweet. So, and then, so that's kind of the impact that's had. And then I wanted to share, I'm losing a volunteer. She's actually 60. She started her career. When she started Bone Builders, she told me she never thought she was athletic. She hadn't done anything that was physical really in her life. She was 40 pounds heavier than she is now.
Wow.
She has gone through the program to be certified as a senior fitness expert or something like that. She's going to be teaching, she's quitting, she's getting a job at LA Fitness to be a silver sneakers instructor. And she wants to.
The fact that also that center is interested in seniors. I mean,
Yeah. And her goal is, she said, I don't need the money, I'm retired. I'm gonna have fun. But she wants to be a personal trainer to seniors. So we've launched a career. We sent somebody off in the memorial, we've launched a career in one of our instructors. So I'm sorry to see her go, but it was such a cool story. That's what I have.
Great, thank you.
So I have some pictures from September. We had our big Mexican Independence Day celebration at Palm Vista. So all three of the senior centers came together for this event. I know a few of you guys were there. We had 140 seniors came and participated, which was a great amount. And it actually worked out really well, the setup and everything. It kind of been the first time that we had done that in a long time. So we were worried about the logistics of everything, but it turned out really nice. And I want to say thank you guys for the raffle prizes that were also donated for the event. As you know, raffle prizes are always fun for our seniors too. And then we also, because of the way Palm Vista is laid out, we have this nice little sidewalk that goes around, and we set up health and wellness vendors. And we also have like a bingo card, so they could, check off 8 vendors and be entered into a bigger raffle, which they all really enjoyed. So, and that was a good use of the space too, and a good way to kind of incorporate health and wellness and having fun at the same time. So these are just a few of the pictures. We had a cute little dog from Palm Regency that was a service dog for elder abuse, which is really interesting. But he was sweet and hung out with us all day.
I was just impressed that Palm Vista you could do that.
Yes.
Mhm.
Yes.
For 140 people, we need to get bigger spaces.
Yes.
And there was space for even more.
More.
Yeah, that was great.
Yeah. And we had a little volleyball game, chair volleyball, that was set up by one of our vendors as well. So we had health and wellness. We had like a game. We had, music. One of our seniors, dressed up and actually sang a few songs as well. And we were able to serve everybody their lunch out there, which is really nice.
It was good too, I think, with the show.
Mhm.
Because there's no parking.
Yeah.
That's the only problem that happened.
Yeah. Very
I wasn't
even.
there,
And
but
so it was nice. Very even ground. So that was also beneficial for us. So some more September highlights. I like to include photos because I think it's always fun to see what's going on at the centers. VCAAA in the upper left-hand corner hosted a Living Within Your Means workshop and budget class. And that was, yeah, they had a good outcome. She actually went over her time because people had so many questions. And she provided in English and in Spanish. So that was a really good class for everybody there. The Alzheimer's Association came in and did a workshop about caring for somebody with Alzheimer's and what the disease progression actually looks like. So they had a good outcome for that as well. And I was also at SOC. And then the St. John's Wellness Exercise class, I just think they have such a fun time. And it's, twice a week at Palm Vista. So it's a good group that they have going on there. So it's a good exercise class.
BCAAA do that. Living Within Your Means.
I could ask them to host it again.
Because,
Probably at Wilson,
a lot
like
of
do
people,
different.
They didn't probably come and
Yes.
heard about it and they go, oh.
Yes. Yeah, definitely. And especially with good outcomes of the class and her going overtime, people have a lot of questions about living within your means. So it was good. I can
Also,
definitely
let me
touch
just
base.
make a note. So you St. John. Sister Suzanne had applied for a senior commission grant for wellness classes over at Boys and Girls Club. And she had reached out to me asking if it was okay to use some of those funds to replace some of the chairs for the Bone Builders class. And I said, it's within the grant funds, but let me just run it by the commission. So if there's no objection, as I say. It's still for the exercise. The chairs are very important. So she said they're home.
Okay. Some more September highlights continued. We had our annual Wii Bowling tournament at Pleasant Valley, which is always a big event for us. And we actually placed really well. One of our seniors won placed first at the best bowler, so he had the best score. South Oxnard actually won second place for the competition, and Wilson won third place. So we had a first, second, and third, so that was really fun, and they had a good time getting all together, and it's something that they really look forward to. So upcoming events for October, I have a few things, so feel free to mark your calendar. I'll kind of go through them just so you know. We just had our first holiday float meeting at Wilson. Once we get our supplies in, we'll start working on the painting and getting everything kind of started for that. We're really excited for the float this year. Wednesday, October 10th, which is tomorrow, from 6 to 7, we're going to have a breast cancer awareness Zumba-thon at Wilson. And it's a $5 donation for the instructor, but half of it's going to be donated to St. John's Breast Cancer Center. So everybody's welcome to come out for that or spread the word. And of course, wear pink if you can. Friday, Saturday, October 12th and 13th. That's yours. I'm trying to read your acronyms.
It's my
Tai Chi.
Better balance.
There we go. So if we know anybody who'd like to be a new instructor, right?
Yes.
I'm trying to recruit.
She said she wanted to come.
Trying to figure out.
Let me have the first weekend.
So Sunday, October 14th, which is this coming Sunday, Pirates Dinner Theater Excursion. I believe we still have one spot available, as last I checked with Alma. So if anybody knows of anybody who'd like to go there, I believe the fee is $60 for the dinner. So, and the show, of course. Wednesday, October 17th at 10:45, there's going to be a breast cancer awareness presentation at South Oxnard from Every Woman Counts. And they're from the Department of Health. And they're going to have all sorts of screening information, flyers. They're going to talk about the importance of obviously taking care of yourself and getting your exams. Thursday, October 18th is at Wilson Park, the tree planting meeting is going to be happening at 11 a.m. And it's actually going to be in the Wilson Center, but it's for the Wilson Park. Yeah. So you guys are welcome to come to that for your input regarding what they're going to plant and where and all that good stuff. Thursday, October 25th, 10:15, there's a farmer's market outing for Palm Vista, and we shuttle people over to the farmer's market for a little morning outing. And of course, our big event this month is the Halloween celebration, and that's going to be all three centers coming together at South Oxnard, and it's going to be a really fun time. We're going to have a costume contest, so you're all welcome to come. It's $7 for a ticket if you'd like a personal pizza, or just $3 if you want to bring your own lunch. So those are our upcoming events. And I think that's, yeah, sure.
So the subcommittee reports, and I do have a little more information to give you. A little handout they gave us at the Ventura County Area Agency on Aging, VC. And it's a little fact sheet about some of the things that happen through VC AAA. And they serve older adults, people with disabilities, and they serve 25,885 customers in the last calendar year. For the high cap counseling, and she told us they served 4,049 clients and saved $1.5 million. Helping people save their money. They do the meal service, they serve the meal at different centers, and the home delivered meals. And I have some figures on that. In the city of Oxnard, they have 35,600 contracted meals a year, and 1 out of 5 people who participate don't have enough money to buy food, so it's a real gift to them. They help 3,241 seniors stay in their homes because they provide case management, meal delivery, personal care, chores, minding health. Anyway, all that helps those seniors. And then the ombudsman program, they go in and visit people who are living in residential facilities like nursing homes. They made 4,515 visits, and 100% of the complaints were resolved. So people that live like in Glenwood, that they're having trouble, the ombudsman helps them work through their problems. One of the things that they showed us, and this was very interesting, they have the seniors divided by supervisorial districts in Ventura County. And our, like Ojai and Ventura, they serve their percentage of customers served by the district, 27%. Then you get Thousand Oaks, Newberry Park, 24%. Oxnard 10%. We're not getting the services that the other districts. And we probably need more services here because, so anyway, squeaky wheel.
But how do you do that though? Is that because we provide those services
As
through the
we just
center?
haven't demanded it, I guess.
So these are services directly through BC AAA.
Right. Or
So
people
it'd be like
just,
the David's
I mean, my gut reaction, people aren't aware of those services. There's a lot there. Maybe they do
So
a better
it's-
job in the other cities.
She just said, Marlene said, clearly, we're not doing a good job of reaching out to Oxnard.
Yeah, there's some disconnect somewhere.
Well, I will say from my experience trying to promote the two programs, we don't have a newspaper. So where do new seniors get most of their news?
That's what we're trying to figure out.
So anyway, it's an important piece of information as we move forward. It was kind of startling. And I think that maybe we should go talk to Supervisor Zaragoza and say, how can we see that our seniors are getting more services? I think because they're talking about the supervisorial district. So that's just an idea I have. So anyway, that's, and
Could one of the issues be is that when people come to our senior centers, and even though the program is offered by BC AAA, they may assume, if they I'm assuming they fill out a survey to get this or however.
So here's the thing, if you look at these services, and my question would be, how many programs are you delivering in each of these
Yeah.
locations? So this percentage might indicate, and would be my guess, that they're not bringing their programs to Oxnard.
Right.
Therefore, our seniors, when their programs come to Oxnard, immediately their classes are filled. To get, and we've met with BC's AAA, to get those services here has been a battle. We tried to partner with the Tai Chi program and to have them execute the duties that they promised. It wasn't being met. And those 7 classes starting now, the amount of trainers coming out for the Tai Chi that was part of their duties to help build, find locations, get those classes filled. And then things were moving. Those 7 classes are since Mary Sue has taken over. So it's been a battle to make Oxnard, we're not seen as, even though we do have the highest population. Now, let me say this. When it comes to senior nutrition, they take care of us. If you look at the last senior nutrition meeting, they approved additional funds of $92,000.
the program's gonna grow.
Of the $92,000, they approved additional funding, $75 shy of $40,000 for us. So I'm gonna be going back to council next week for an additional 7,000 meals that we will be able to serve. So, it's just.
That's interesting because, and then we have more nursing homes, I think, than any other. So the ombudsman are serving, the Oxnard nursing home. So why we're only 10%.
I think we need to sit down with Zaragoza and say, somebody needs to sit down and say, this is just unacceptable.
And these are their figures, they're not our figures. So anyway, and then I wanted to pass these out because I want you all to have good nutrition.
Good nutrition, really.
This from the Department of Food and Agriculture, and that's all part of the senior nutrition program. And this is where those coupons came from, the California Department of Food and Agriculture that I handed out. So I think that's what I have to say about BC AAA. How about you, Clark?
No, you've covered well, thank you.
But it's kind of a mystery, you know, and it's such a hard acronym. Say BC AAA, everybody thinks Auto Club or Alcoholics Anonymous.
Right.
So anyway, okay, and so now the new senior center.
New senior center. One of the concerns the new senior center has now is we thought we would be able to have this architectural firm that was hired to have the renderings done before the election come to 6. Well, it got hung up in attorneys finding a contract and solving it. So it still hasn't been completed yet. They haven't officially been hired yet. So one of the problems that we're now facing is that there are going to be two new people for sure on the city council. We have a new city manager. So we've got a lot of educating that people do. And we, you know, let's see, how do I politically say this right? I live in a district that's not electing somebody. The rest of you are, you know, four of the districts are all electing somebody. And if they re-elect the people who are currently on the center, they know about the new senior center. But if new people come in, there's going to be more new city council members that don't know anything about a new senior center. So we're on the move to try to educate people. So we have a meeting with the new city manager on the 24th of this month to educate him about what's the new senior center and get him on board to make sure we get that parcel of land. And he's always backing us through the money that they came out, have for hiring this company. So there's a lot of things we're working on. We still don't have our official 501c notification. We're still waiting for that to come through. They you know, gave us a letter saying, yes, you're on the list. We just don't have to go through the process. Which it could be, what, 6 months? Is that what?
No, 90 days,
Well,
but it's pretty close to 90 days now.
I thought 90 days was the end of September. Well, anyway,
Yeah, it could be.
so we hope to have that soon. Anything else to
No, I think you covered it well.
where we are, so.
I had a dream last night about the city manager.
Oh,
I don't know. Why would I dream about the city manager? But it all went well, Kay.
Oh,
It's good to know.
So maybe I turned into an oracle.
yeah, Renee, you have anything to add?
No, I think you got it covered. The city attorney has had the application for a bit. RNT, the architect, heavily marked up the agreement, which is a very standard agreement. And from what the city attorney has said, they've never received that type of markup back from, because it's such a standard agreement. So I think that that's causing quite the struggle of how to approach it. Basically, where it's at with the recommendations from the architect, they couldn't move forward. So they're figuring out how to rebut that. They're working on it. They met last week. I haven't heard anything.
But if you're going to any meetings of who should you vote for, you know, they have these things. If you have an opportunity to educate, you know, at any of these meetings, or you meet any people running for election, ask them the questions about senior center and where are you on this and do you know about this? To be sure that, you know, it still stays in everyone's
Good idea.
mind.
Okay.
On a more mundane question, since I have some neighbors who have outstanding checks, including myself,
I know.
what should we be telling people?
Well, we're trying right now to go under gray law 401c, so that we can officially get a checking account.
Oh, I see.
So we can put their checks
So
in.
just tell people to.
Yeah, and we
That's
did
all.
contact a number of people. We let them know where we were and why this is a problem. It's opening a checking account is what's hanging this up. We have to have this final letter from the federal government about our thing, or about our 501c status in order to open a checking account.
And I've gotten used to every month knowing there's a 30-hour. I'm gonna try to balance.
I know,
There's always a 30-hour difference.
Yeah, I've got one for 75.
We don't like it either.
Yeah.
And I'm sure not. The money's just sitting in an envelope.
I know, and we can't use it to start PR and doing what.
Well, we're forward thinking, just a little premature
Sure.
there.
Right.
Okay, do we have a report from the immediate and critical needs of the auxiliary senior population?
Yeah, so that would be Alice and myself. The last chapter is under construction. It'll probably, I'm going out of town for it, so probably the week I get back, I'll send Renee a copy for review, and the hope is to present it. And we presented the first 3 topics, meeting that nobody attended. I think basically,
in
even Alice was gone.
July.
Yeah, it was basically Zal Clemens and Mortis, so the janitor.
Everybody was here.
I mean, the staff was here.
I came to the trivia, they had a trivia, banned books, and the poor guy, he's new at the library and he started doing programming. And there were only 2 of us that showed up. He was so glad when we showed up, you know, that you never know.
So hopefully next month. That's my commitment.
Okay. So commission comments, and I just wanted to report that Kay and I went to the Parks and Recreation Commission meeting this last, well, I guess it was their September meeting. And I talked about the Rose Garden and starting some kind of commemorative program. And Renee had found this wonderful model from Michigan. So I gave it and I said, we'd love to work with the commission to start a commemorative program. And Roger Portier, is that his name? Yeah. He said, well, that would be me and I'll contact you. And then Kay told them about the new senior center because that will be under the parks thing. So we want to keep working with them so that they know what we're doing. And I had an invitation to present to the Community Relations Board. The last minute they canceled a meeting, was all ready to go, and they canceled it. Mary Sue was going to go. So then the next week, they wrote me that morning and said, oh, we're going to have an emergency meeting. Can you come? And I couldn't. I asked Jeff if he could come, Kay, and, you know, we just can't, we have to know ahead of time.
It's literally like 40 years.
They just kind of have trouble, because this happened before, in June, I think they canceled
We were
this.
supposed to go at least once.
Yeah, they didn't have a forum. So anyway, we are in demand, but not, it doesn't always work out. And Renee is going with me Thursday to see Father Marco at Santa Clara. This is part of our marketing. So hopefully we'll take one of these and let him know so that he can let his parishioners know what is available and if they have some.
What church?
Santa Clara Church.
When I was with Santa Clara, which has been over a handful of years ago, as an educator, they had about 13,000 registered families come through that church. So that's a huge base to get our information out to.
And I'm sure that they have parishioners that are having trouble getting groceries or having trouble.
And they used to have St. Vincent de Paul and they no longer do there, so there's definitely.
Anyway, we're gonna do that Thursday. So that's what I have to report. Does anybody else have something?
Well, I just had a couple of questions. One, there was some emails that went back and forth going to the library. Is there anything new happening with that?
I think that's a work in progress with this
So-
new program.
So, they have put together, all of you are familiar with our rec guide. So they put basically a library guide. When Ingrid was here, who was our director of our department, she was really trying to move us in the direction of developing a department guide, a cultural and community services guide. Recreation has had a guide for many years. The major distribution of that was going to our school districts. So we had about 30,000 going out to the different school districts. The school districts moved into the direction of digital. They no longer accepted printed material. So we were discussing how we would adapt to that. Since all of those changes, we've lost Martin, who puts together our rec guide. He moved on in his career, and the library has started their own guide. I've spoken to 2 staff members here who have not given me any sort of response, but I will poke and prod, I'm good at that. Along with my boss, Carol, who's sitting as the interim director, sharing the concerns and, can we at very least get a blurb, our phone number, our website, something. Not asking for a whole lot of space, but we gave a portion of our space of the rec guide to the library for many years. So I'm having that discussion in different angles. We do bring our calendars and are able to distribute them at the libraries at this time. But
it's kind of exciting that they have a new program manager. And
Well, it shows there's a need for it.
well, there was, so we've gone through a couple. The last one left about 2 months ago. And so there was a period when there wasn't anyone doing that position. So this new gentleman has come on and shares, if you look at our senior calendar, the library information. So this shows a little bit of bridging happening, but what we're trying to do as a department is come up with themes where we are, we're all celebrating Halloween one way or another. So this, and you'll see at the very bottom of this flyer and this went out citywide. It's on Channel 10. This with our senior holiday Halloween party. With this. So we're really trying to move in the effort where we advertise all of our programs based on a theme, and it goes out something similar to that. So, we'll continue. Every avenue, anytime I hear about something new, it's an opportunity. So,
do we have anything you want to put on the agenda for our next meeting?
The Rose Garden, the Rose program.
Commemorative.
Mostly to keep it in the forefront
Right.
and with that.
Can't even write. I can understand.
I also, if I
And
can,
also this kind of bothers me at 10%. One, I think we need to find out how do they use statistics?
if you look at now that I see this map, the District 5 is much smaller than District 3 based off of the way this looks. Now, I don't know how exactly this is, it's not an accurate map, what it's showing each city, but my question would be what's the population and how many programs are in each
And
location?
actually, this district, there's a little section of North Oxnard that has a different supervisor. I don't know how they do
So
that.
here it states number of people per district, and our district has the least amount of people, but that's served. So it's just not,
Does OI even have a senior center?
they have,
They
Oh,
have
the
the
help of Ojai.
Help of Ojai, yeah.
But it's not really like what we call senior centers. It's programs they offer. So maybe the way they're counting, so more of their programs are provided by BC than the programs we provide, because the city actually pays for it.
But how many people are served in Thousand Oaks and City Valley? They have very big active senior centers.
Yeah.
Yeah, of course,
I don't know.
that goes by question.
But,
yeah.
and this is interesting, the diversity of the participants, 28% minority. I don't know, 36% low income, 24% Hispanic. So, you know,
Yeah, those two.
that's really, you know, we're not represented.
And I think my guess, and this is really a guess, but when you're splitting up the area for representation, you probably try to get either like communities or divided by amount of population.
I don't know, and I'm wondering,
Santa Paula Fillmore is only gonna have 50,000 people versus Oxnard has 200,000 people.
but this District 3, I think that takes Santa Paula, Fillmore, Pyru.
No, that's just.
Oh, no,
You're-
no, it goes down. It's funny how they,
Camarillo.
but,
That's right.
and each supervisor appoints a representative to BC Triple N. I don't know who Zaragoza
It used to be
appoints.
Joyce Peeper.
No, she's not on there, so I don't know who it is, or if even has one, but I don't know. I'm gonna take your lead. If you think we should set up an appointment, I'll set up an appointment.
I think that we will take any more programs than we can possibly get.
Mhm.
They're well received here in Oxnard.
Yeah, that is a
So
problem.
we can definitely take advantage of more programs.
Maybe go to BC Triple A first and find out where these members come from. How did you?
That would be my thing is,
And minorities
what are
and
the
Hispanics are
senior
the-
population?
You know, how do they, what do they mean by minority and Hispanics? You know, in a sense, Hispanics are not a minority in Oxnard.
No.
So I don't know,
The
but
numbers are not.
Yeah, something.
when she gave us, I can't remember, this was awful aging, that she gave us this, but she said, clearly, we're not doing
Right.
a good job of outreach to Oxnard. So
They call her-
she acknowledged it. I just kept my mouth.
So under items of future consideration, if everyone's okay with it, we'll add the marketing plan.
Okay.
The subcommittee has met and ironed out a marketing plan, and it's in full effect at this point. So just so everyone knows what efforts are being made, I'll go ahead. That's what the
Okay. Oh, my phone is ringing. Anybody want to make a motion to adjourn?
I'll make that motion.
Okay, all in favor, raise your right hand. Okay, the meeting is adjourned.
There you go.